I'm Dr. Trey Martin with Pursuit Physical Therapy. So this video is going to be really important for baseball pitchers mainly. So we're going to go over how to assess internal rotation and external rotation and the overall arc they form. And then we're going to compare that side to side. So one thing we found in research is that we want the left side arc of external rotation plus internal rotation to be within 5 degrees of the opposite side arc. So I'm going to show you just a quick demonstration of how we assess this here at Pursuit and how this is going to tie into your baseball throwing program, prevent shoulder injuries, and help you perform better. So just a quick assessment for this. When we're assessing for external rotation, we bring her up into the scapular plane here, and we go into resistance here. We don't want to crank and cause pain here, but we just try to find the end limits of the range there. We would measure this with a goniometer to get a good range of how much external rotation, and then to complete our arc, we go to this side and we go into internal rotation. So one thing to look for that we look for is we don't want to see the humeral head pop up like this. So it's good to get a little bit of stability there, and then we measure this angle as well. So once we get those two numbers, we want to compare it to the other side. And one of the most important keys to this, and something we got wrong as a profession for years looking at baseball athletes, is these two don't have to be equivalent as far as external rotation on this side doesn't have to equal external rotation on this side. We're looking at the whole arc. So just throw some numbers there. Say Monica here has 130 degrees of external rotation and 45 degrees of internal rotation for a total of 185. Check my math on that, YouTube. Not 100% sure. And then on this side, she has 100 degrees of external, so 40 degrees different, but she has 85 of internal for a total of 185. That's A-okay. So one thing we see with throwers is that the act of throwing itself creates bony torsion on the humerus. So that's going to reset your ranges of motion. So over time, your bones are going to adapt in a twisting type fashion. So you're going to have a different range of motion. And one thing we see that's been an error in a lot of trainers' minds for years is we try to correct the internal rotation deficit, which is also commonly known as GERD. And that's actually going to lead to more injuries because if you have a ton of external rotation on this side, not much internal on this side, we don't want to crank you into more internal rotation. That's your natural range of motion, and from the bony adaptations of years of throwing, that's going to be a normal change for you. So that's okay. So that's one of the most important things we look for in throwers, and we're actually launching a Pursuit Baseball Performance program in the next coming months. So that's going to be something we're going to check for along with other things to get you a good glimpse of, is your arm mechanics proper? Is your biomechanics appropriate for throwing? How can we improve these ranges of motion to get you equivalent side to side to lessen your injury risk, help your performance, and make you overall a better baseball player? Thanks, and see you guys next time.